Hello and welcome to GCSE Infection Response. And Mrs. Castanera here, and we are doing lesson 2, learning about coronary heart disease. So the questions we'll be looking at is, what is a non-communicable disease? What are the causes and treatments of coronary heart disease? So today's lesson is titled Non-Communicable Diseases. Our key words for today are non-communicable, coronary heart disease. So there's only 2. So what I'd like you to do first is I'd like you to have a go at the knowledge check, please. And if you pause the video so you can do that now. Okay, so we're going to go through those. Question 1, define the term health. So health is a state of physical and mental well-being. Question 2, state 2 lifestyle choices that can affect health. That would be diet and exercise, but there are many others to choose from. Smoking, drinking alcohol, use of drugs, recreational drugs. There are many options to choose from. Question 3, define the term risk factor. So a risk factor is something that increases the chances of getting a disease. Question 4, state a risk factor for type 2 diabetes. So the main 2 are diet and exercise, or lack of exercise. You only need one of those. Question 5, state the risk factors that can affect babies in utero. So that would be alcohol, smoking, use of drugs. Those are the main 3. We're not going to worry about question 6, it's essentially millions. Question 7, which is the biggest blood vessel in the body? That would be the aorta. Question 8, the heart pumps to which places? That would be the lungs and the body. So if you could give yourself a mark out of 7 for that, please. Anything less than 4 and you really need to have another go at that. So today we'll be understanding the term non-communicable and we'll be evaluating the risk and effects of coronary heart disease. So non-communicable disease. Non-communicable diseases cannot be spread between people or between people and animals. They are generally long-lasting health issues that get worse with time. So they cannot be spread between people or people and animals. They are long-lasting and they get worse with time. So there are some examples of this. Okay, so for example, genetic illnesses. So a genetic illness is something that is passed on due to your genes, so by biological parents to their children, and that's things such as Alzheimer's, Huntington's, or motor neurone disease. Okay, so normally they're multi-issue diseases. That means that they affect more than one area of health and more than one part of the body. So it might be that they affect parts of your different parts of the body, so different organs. So one example of a non-communicable disease is cardiovascular disease, and this is a term that describes diseases of the heart and blood vessels. Okay, so it's diseases of the heart and blood vessels. So I want you to very carefully type in this link, please. So watch the video, which will tell you all about cardiovascular disease. You'll need to take some notes on your student notes page, please. Coronary heart disease. So coronary heart disease, also referred to as CHD, is a problem with the arteries that supply the blood to the heart. Okay, so that's why it's a cardiovascular disease. Cardio meaning the heart, vascular meaning the vessels, so the heart and blood vessels. And the arteries, these arteries, we call them the coronary arteries. So coronary means crown, and they sit like a crown around the heart. So these coronary arteries, they can get blocked with layers of fatty buildup. So they get blocked with these layers of fatty buildup, and the fatty buildup is called cholesterol, and it's usually due to a poor diet. So you might have heard of a high cholesterol diet, and so that's a diet high in animal fats typically. So this fatty buildup has a name, and that is cholesterol. Sometimes you might hear it be called plaque as well. So it's called cholesterol typically as something in your diet and something that can be in your arteries. When it's referred to as plaque, they're typically referring to the layers of fatty buildup specifically inside the arteries. So this fatty buildup, this cholesterol or plaques of cholesterol, causes the arteries to narrow. That is a big problem. And that in turn restricts the flow of blood. So less blood going through narrow arteries means that there is a lack of oxygen to the heart muscles. Okay, so if you don't have enough oxygen going to one of your muscles, then that muscle is a cell and it needs oxygen to work. So if you don't have enough oxygen going to those cells, they will stop working properly. And that is what happens. If there is too much narrowing of the artery, then there is not enough blood flow, not enough oxygen gets to the blood cells, not enough oxygen gets to the heart cells, and then there's not enough energy in those cells, and that results in a heart attack. And a heart attack is when the heart stops beating. That's very serious. So we're going to write a little note about that. Okay, so that's due to a lack of oxygen from the blood cells that they just can't pass through the coronary arteries. So we're moving on to the next page now about treatment. Now, there's a video here that I'd like you to watch, and I will show you the link to that just a sec. So now that we've watched that video, we're going to go through the different ways to treat coronary heart disease. So make sure you've watched the video first, otherwise this is not going to make as much sense as it would otherwise. So, there are different ways to treat coronary heart disease depending on how serious the individual case is. Okay, so there's different ways to treat it. There are actually quite a few options. So if the issue is caught really early, a change in diet and lifestyle is very likely to be enough. So if it's caught early, a change in diet and lifestyle is going to be that's all that's going to be needed to lower the cholesterol. Okay, so that's important, to lower the cholesterol, because it's cholesterol that is responsible for the fatty buildup. Now, we haven't really described what cholesterol is. So cholesterol is, this is a bit long I'm afraid, a fat-like substance and so it builds up on the membrane walls of the arteries. I'm going to zoom in so you can see this better. So cholesterol is a fat-like substance and it builds up on the membrane walls of the arteries. And so it narrows them. And that makes it harder for the blood, which is carrying oxygen, to pass through those arteries. Okay, so there was quite a lot there. So if needed, you can go back and pause the video. Okay, so I'm going to hold that first half there so you can pause the video to write down what you didn't get. And just moving up, and that's everything to the bottom there, just so you can make sure you've written everything down, so you can pause the video if you need to. Okay, so we're going to zoom back out. Okay, so the first treatment is diet and lifestyle, and that should hopefully reduce cholesterol and fix the problem. Now, if this doesn't improve patient blood flow, which is the important part, so it's got to improve the patient's blood flow, then a next step is to give them statins, which is a drug or a type of drug, and these reduce the amount of bad cholesterol in their blood. So there is two types of cholesterol, bad and good cholesterol. So the bad cholesterol is called HDL sometimes, so high density lipoproteins. That's the kind of fats you get in animal products. So we're talking butter, meat, cheese, those sorts of foods, very rich foods. The good cholesterol can be called low density lipoproteins, and they are the kind of fats you find in fish, oily fish in particular, plant oils such as olive oil. So a lot of the time, if you're shopping and you see something that's advertised as low cholesterol, it's probably made from, say, olive oil or something like that, such as the olive oil based plant spreads instead of butter, things like that. So there are disadvantages and advantages to statins. So their advantages are that they decrease the bad cholesterol and they reduce stroke, heart attacks, and coronary heart disease. So that is a significant advantage, very important advantage that's necessary. However, and they can also increase the level of good cholesterol in the blood as well. That good cholesterol we were talking about, that helps things to flow well. So once you've started taking these statins, you have to take them regularly. It's not like a course of antibiotics where you take them for 7 days and everything is fixed and the problem has gone away. These are something that only work as long as you are taking them. So for someone who has got coronary heart disease or is at risk of getting it, these statins have to be taken every day for the rest of their life usually in order to prevent serious damage and serious coronary heart disease. So once you have started, you have to take them regularly. So usually there is no coming off them unless you make significant lifestyle and diet changes that are good enough to reduce that risk to virtually none. So when I write that they do not cure CHD, they just treat it, that's what I explained earlier. It's not a cure that you can take once and it's fixed. It's something that's a treatment that's constant. So it also has side effects. There's quite a number of side effects. They range from headaches, kidney failure, and liver damage. That's just a selection of them. There are more side effects than this, especially in their list of common side effects. So common side effects also include muscle pain and sickness. So if it's a little bit worse than this, if the fatty deposits have already built up over time, then a stent may be needed. So if they've already got significant fatty deposits that are stopping or slowing the flow of blood, they might have already had some kind of heart attack or stroke, then a stent may be needed. So a stent is a wire mesh, and it's a sort of tube, and it's inserted into an artery to widen it. So this tube is not even as wide as a pencil usually, and it goes in very thin on the end of a wire, and it goes into an artery either in the wrist or in the groin. Okay, so the groin is next to the crotch area between the leg and the torso, and it goes into a major artery there, and they feed the wire up the arteries into the heart and into the coronary arteries around the heart, in fact. And then when they get to the blockage or the area that is narrowed and thinned due to these plaques or fatty deposits of cholesterol, they then open up the stent, which looks a little bit like one of those finger traps you may have seen as a child. And so it's just a mesh crisscross of wires, and it opens up. So that pushes open the blood vessel and makes sure that the blood can pass through it clearly. So it's inserted into an artery to widen it, allowing the blood to flow. So when they do this, usually they don't give you a full anaesthetic. They literally just numb the local area where it's going in. They keep you awake. Sometimes they do have to give you anaesthetic, but it is still an operation, and it carries a serious risk of infection and blood clots, in particular thrombosis, because what they are doing is they are passing that wire through that artery that is already very blocked up, and there can already be blood clots starting to form in those arteries or around the blockages. And if they make one of those blood clots loosen, that blood clot can travel around the body and then cause a stroke to happen, which is not good. So there can also be further issues as well. Okay, so when we talk about further issues, so it could damage the heart or the valves inside the heart in particular. So that's a serious risk. So that could be that it's just something that's already there. The person already has these problems from birth, or some damage that's happened to the valves because of separately to coronary heart disease. So when we talk about damage to the valves inside the heart, this could have happened at birth or separately to coronary heart disease. And so then they may need replacing those valves. Again, that is another operation with more risks. Sometimes the problems with the blood flow is not due to blockages in the arteries. It can actually be due to problems with the valves. And so those valves can be replaced, which is good. They get either biological ones from a donor, so an organ donor, or mechanical valves, which to be honest I think might be more common because donors are not as common as we need them to be. There are a lot more people needing donors for organs than there are people available to give them. So sometimes the heart is so damaged that an entire heart must be transplanted, not just the valves, which means more than one person can get parts from a heart, but the entire heart needs to be transplanted to a person. Again, a heart transplant would come from either a donor or an artificial heart, can be used until a donor heart is found. Okay, so that's usually called something called ECMO, ECMO, and that is very expensive and difficult to do. So we've already watched the video, and what I'd like you to do is have a look at this list here, this table, and what I'd like you to do is have a go at filling in some of the advantages and disadvantages to each of these. So they're all in the video and they're all listed here. Once you've done that, I expect you to spend sort of a good 5-10 minutes having a go at this. See if you can write at least one thing in each box, and then we'll go over it. So pause the video whilst you do that, and then we'll review that. So having completed that table, hopefully you've got a number of these written down. We've added in a column of description to describe what that treatment is, and this is a nice little aide-memoire for you, which means a memory aid, and that can help you to learn the different treatments and their advantages and disadvantages, because this is very commonly a 6-mark question in the exams. And so you will need to know a number of advantages and disadvantages for different treatments. And you may not get to choose which treatments you talk about. It may be chosen for you. So I'm not going to go through this now because it's take a very long time, okay? But you should be able to get a copy of this from your teacher. They might have sent it to you when they sent out the work, or if they haven't, feel free to email them or myself to get a copy of this. Okay, so there's plenty of it. So as you can see, there's rather a lot there to go through. So we're going to move on to the checkpoint now. And the question is, explain 3 ways a person could reduce their risk of cardiovascular disease. So we're looking for 3 ways that someone could reduce their risk of cardiovascular disease. So not how they could fix it if they've already got it, how to prevent it happening, what risk factors are there to a person, and 3 ways of reducing those risk factors. This is worth 6 marks. Okay, so in order to get 6 marks, you need to make 6 really solid statements. So sometimes a statement that you think might be worth 2 separate marks, you might only get 1 mark for from the examiners. So I strongly recommend that you write at least 6 separate points, maybe even as many as 10 or 12. And you want to explain why you're doing each of your suggestions. So if you want to say they should do something, explain why they should do that. Why does that reduce their risk? So I want you to have a go at this, please. Pause the video whilst you do that. This should take you a good 5 minutes or so, maybe slightly longer. Okay, so here is the mark scheme from this, from when it was an actual exam question. So they would like any 3 suggestions plus the explanation from these 4 points. So you have to get the suggestion and the explanation. So the suggestion here is eat fewer fatty foods. It might be improved diets, low cholesterol foods, any of those sorts of suggestions. And then the explanation is the 2nd mark, so that's 1 mark. The 2nd mark is to explain that it would either reduce the buildup of cholesterol or that it would prevent or reduce the blocked arteries. Ideally, you've written both. So that's your 2nd mark there. Okay, so the next point is to ensure your energy input in food matches your daily energy consumption. What they're really asking you to do is say, make sure you maintain a healthy weight. So you could have said, stay active. You could have said, essentially anything around keeping your lifestyle around maintaining a healthy weight. And the idea here is you want the explanation to stop you storing fat. You don't want to be storing fat. Okay, so to ensure that fat is not stored. So that is preventing weight gain. Okay, so it's preventing weight gain. Okay, so your first point is to maintain a healthy weight, and the explanation is to prevent the weight gain, and so that it's stored as fat. Any 2 of those 3 for that bullet point. So each bullet point is worth a maximum of 2 marks. Okay, the 3rd one is if they are obese or overweight, okay, then they could do any one of these things: exercise more, consume less food, eat less essentially, or eat lower calorie foods. And the idea being that they're going to lose the excess weight. Okay, so any one of this list for the 1st mark, and losing the excess weight for the 2nd mark, so reducing fat storage. And the 3rd mark is going to be things like stop smoking or don't start smoking. Okay, so that's going to be your first point. And the explanation for that is something along the lines of it narrows the blood vessels or damages the artery linings, or it increases the risk of clot formation, increases blood pressure, any number of these factors. Okay, so those are all the things you could do. So you could easily get 8 marks from this. So give yourself a mark out of 6 for that, please. Now, if you got 3 or more, you're doing well, okay? Especially if you're in year 9 or 10 and you're still getting 3 out of 6, you're doing really well. Okay, by the time you get to year 11, you need to be getting better at answering these. Okay, but these are the questions designed to test everybody all the way up to the highest grades. Okay, so if you got 5 or 6, then you've done amazingly well. You should be really proud of yourself. If you got just 1 or 2, I want you to have a good look at this and see if you can understand where these have come from and why these are the risks for cardiovascular disease. You need to know that they're the risks, first of all, and then understand why each suggestion is given. Okay, and that will help you get the second half of the marks. So we move on to the knowledge and application check. So I'd like to pause the video whilst you do these. There are 9 questions on this page, and then it goes on to the next page where there are another 2 questions. Okay, so questions 9, 10, 11 are a bit trickier. You might need to spend a little bit longer on those. So pause the video whilst you do that, please. Okay, let's go through those. Identify which part of the body cardiovascular disease affects. Well, it affects the heart and circulatory system. You might have written the heart and the blood vessels. I would say that's the same thing, that's absolutely fine. The best answer is circulatory system, but we will give you it if you wrote heart and blood vessels. Which part of the heart does CHD affect? CHD means coronary heart disease, and it affects the coronary arteries. Make sure you're ticking these as you go. If you didn't get them right, please put a cross and then correct your answer as we go. Question 3. State what happens to the artery when fatty deposits occur. So the artery slows down and reduces blood flow. Question 4. Define what a stent is. It's a wire mesh to widen arteries. Question 5. State what statins are. So statins are a drug. They are a medicine, but they are also a drug. They are a legal prescribed drug. Question 6. Define what statins do. So they reduce the formation of cholesterol in coronary arteries. They reduce the cholesterol in the blood as well. Okay, so they can read that. So they reduce the formation of cholesterol or fatty deposits or plaques in the coronary arteries, or just the blood vessels is fine. So if you've written about reducing the cholesterol in general, you will get that mark. So do make sure you're ticking these as you go or correcting them as you go. So question 7, identify what is meant by a mechanical valve. So a mechanical valve is a heart valve or any valve that has been made by humans, so man-made, and synthetically manufactured. Okay, question 8. Define the term health. Yeah, I'm sure you're sick of this question and know the answer by now. If not, it is a state of physical and mental well-being. Question 9. Explain why a blockage in the coronary arteries could cause damage to the heart muscle. So a blockage would mean that the heart muscle isn't receiving enough blood. Blood carries oxygen and glucose, so that the heart cells can respire or do respiration. If they can't do respiration, they can't generate energy, and therefore they won't be able to contract and relax and beat sufficiently. When I say beat, I mean the heartbeat. So let's write that out. Okay, so that is a long answer, I'm afraid. So let's tick those ones off. So here there's multiple parts. So first of all, we need to talk about the blood supply being reduced. Then we need to talk about what the effect of that is. So the effect of the blood supply being reduced is there's not enough oxygen in particular, and glucose, but I will give you the mark even if you've just written enough oxygen, getting to the cells, to the muscle cells. And so the final mark here is to explain that that means the heart muscle just doesn't have enough energy to beat properly or to relax and contract properly. Okay, so the heart just doesn't have the energy to work, and that causes damage. Okay, so there's 3 marks to that. I'm going to move on to question 10. Explain how a stent will slow the progress of coronary heart disease. Okay, so it will allow the blood to flow efficiently through the arteries to serve the required cells, or to supply the required cells. So sorry, that one wasn't quite on screen. So question 10 was it allows full and efficient blood flow through the arteries to reach all of the heart cells. Question 11. Suggest why a patient might not want to be given statins. So there's a number of reasons. They might not like the sound of the side effects. They might not be happy taking the drugs every day for the rest of their life to reduce their risk of coronary heart disease. And actually, a lot of the time, in reality, patients believe that they can make the diet and lifestyle changes required and that they can do it quickly. Unfortunately, that doesn't actually usually happen. They'll make some diet and lifestyle changes, but it doesn't always last as long as it should, which is life. So unfortunately, a lot of patients who don't want to be on statins have a go at making the required lifestyle and dietary changes and then end up back at their doctor, usually with more severe symptoms, because they haven't been able to make those changes quickly enough to have to reduce the risk of CHD in time. So they will likely have more problems from the progressing coronary heart disease. Okay, so this one was just 1 mark, and this one was 2. So side effects, don't want to take daily medication for the rest of their life. And I will add as a third point here, if you want, although it's an optional extra mark, they think they can make the diet and lifestyle changes. Or they think or they would prefer to make them. Okay, so any 2 out of those 3 will give you the mark there. So let's calculate how many marks we have for these questions here. So we've got 8, 9, 10, 11, 12, 13, 14. So give yourself a mark out of 14 for those questions. Now, if you got less than 5, then you really need to have another good look through this lesson. 5 or less, it's probably not going to be sufficient to get you through your exams properly. Now, if you got 10 or more, then you are doing exceptionally well. Well done, you should be very pleased with yourself. If you've got 6 to 9, then you're doing good. You're on track to continue doing well. And that concludes the end of our lesson. If you have any questions, feel free to email your teacher. And thank you very much.